Thank you very much, Tara. Thank you, Bentley, for organizing this session, and thank you all for being here. I'm going to share my experience with the Bentley BeGraft peripheral stent during FEVAR. Those are my disclosures. And you have to understand that FEVAR has evolved over the year, and this is really very nicely illustrated in Gustavo's book that you should all have in your library, showing that we actually started a couple of years ago using 2 renal fenestrated endograft for juxta-renal aneurysm, and we moved to 3, and now almost routinely implanting 4 vessel fenestrated endograft. And why did we do that? Is because when you look at the anatomy of those cases with juxta-renal aneurysm, most of them have a posterior bulge at the just behind the SMA, and if you don't get a proximal sealing zone above in healthy descending thoracic aorta, there's a high risk of proximal type 1 endoleak or migration during follow-up. So moving to those 4 vessel fenestrated endograft, we had to change our practice, got the graft up on one side, and on the other side we had to access all target vessel, but as you can imagine, it's not always easy to get 4-7 French sheaths through one side to access both renals and both visceral. So we changed the practice, going with 2 renal sheaths and then 2 balloons, and once the renal stent had been implanted, we would replace the balloon by sheaths. But we actually moved to using a preloaded system. So the good thing about that is you have access to the renal arteries from the side you insert the endograft, and the sheaths go directly towards the fenestration, and on the other side you only need to access the 2 visceral vessel. And this is an example. The nice thing about this preloaded system is you have a stable platform at the level of the fenestration, then you can access your renal artery. And same patient, lateral view, and now we're coming from the other groin and getting access to the SMA. Now, moving to those preloaded catheter, there was one issue, is that those delivery systems are only compatible with 6 French sheaths. And the Bentley are actually the only bridging stent that have diameters larger than 6 and length longer than 22 that are compatible with those 6 French sheaths. So this is when we started using them, and we started actually with the 2nd generation BeGraft peripheral stent. 2nd generation had larger stent connectors and had a thicker PTFE coverage. It went from 100 micron to 200 micron. And you can see how the stent is precise in delivery, and you can see a third 6mm stent with a 9mm balloon, and this is exactly what we're obtaining during our cases. And this is a cone beam CT of a 4-vessel fenestrated case performed with 4 Bentley peripheral, a cone beam CT performed at the end of the procedure, and the discharge CT a couple of days later. Now, another specific issue about the Bentley is that it comes in large diameters and short length, which is also the only platform to provide that. And it's very interesting for visceral arteries that often are quite large with a short trunk, meaning an early division, very difficult to deal with longer stents. And this is an example of a patient. And what you can see here is that access to the celiac trunk is not always very easy, but now because we have a 6 French stent, 6 French compatible 8mm stent, we can actually use a 6 French sheath to go into this quite challenging celiac trunk. Then you can see the 8mm stent tracks really easily through the 6 French sheath. Delivery of the stent. Part of the stent, obviously, is inside the aortic lumen, and then the next video will show you flaring of the stent, and you can see there was quite a marked arc ligament here, and we managed to open it nicely with this BeGraft stent without covering the bifurcation of the celiac trunk. Now, the various steps of implanting this fenestrated, this bridging stent in a fenestrated case are first positioning accurately the stent, and then ballooning the stent, flaring the distal, the aortic portion of the stent to get a perfect rivet at the origin of the fenestration to make sure you have a good seal. And I'm going to show you in this video exactly how we manage that. And you can see the stent is in position here. I'm retrieving the 6 French sheath. I'm now going to inflate. Well, actually, Dr. Godric is going to inflate the balloon. And you can see that I'm advancing my sheath against the balloon while he's deflating. And so the sheath actually just jumps into the renal artery very easily here, very smoothly. And then I'm advancing the flaring balloon, which I think here is a 9x2. And you see the balloon is advanced just distal to the fenestration. And again, it's a team approach. Dr. Godric is inflating the balloon, and once it's slightly open, I'm actually getting some pressure on the shaft to have a nice flare from top to bottom. And see what I'm doing here? I'm actually putting some tension on the shaft of the balloon and advancing my 6 French sheath against the balloon prior to deflating the balloon. So when it deflates, again, by putting some small tension on the shaft, you actually manage to easily get the sheath to advance inside the target vessel. So if you do that, then you should not have any issue. This is the early experience in Lille. We actually are going to submit this 101st BeGraft stent implanted in 39 patients, half in renal arteries, half in visceral arteries. And we looked at all issues that can happen during follow-up with those renal fenestrations. And we had only one case where both renals occluded. This patient had a dissection on one side and a kidney hematoma on the other side. This was a patient with a shaggy aorta, quite a difficult case. So in this patient, we lost both renals quite soon. But for the 38 other patients, at 1 year, we have no issues, no type 3 endoleak, no occlusion, and so a very favorable outcome. Now, this is just a transition to Eric Verhoeven's talk. So I told you that we've used the BeGraft peripheral for bridging our fenestration, and he's going to talk now about the new generation, the BeGraft Plus, that has been developed for branches. And I really want to emphasize that we need both platforms, one for the fenestrations and one for the branches. And you can see here in this patient, we use three BeGraft peripheral for the fenestration and one BeGraft Plus for a branch to the celiac trunk. And you can see here a nice result, and the cone beam CT showing nicely the free peripheral in the free fenestration and the BeGraft Plus through the branch. Post-op CT, and this patient had quite a sharp, tight arc ligament, and with the BeGraft Plus we managed to open it nicely. You can see on this reconstruction. So I'm going to conclude by saying that it's a very interesting platform for those of you who are using routinely FEVAR, 4-vessel FEVAR. It's a low profile, 6 French compatible, flexible, very precise, easy to track through quite challenging anatomies, and we have ideal length for this type of procedure. 27, 28 is really what we need, and so far at 1 year we have very favorable outcomes. Thank you for your attention.